rescuers have lifted illegal miners and several bodies from an abandoned gold mine in South Africa, where reports suggest that hundreds may be trapped and at least hundreds are feared dead. A professional mine rescue team deployed a large cage into the mine shaft near Stilfontein, located about 140 kilometers 90 miles southwest of Johannesburg, on Monday. Mzukizi Jam from the South African National Civics Organization SANCO confirmed that the equipment is functioning and has successfully brought up 7 individuals. Community leader Johannes Kwankase reported that at least 4 bodies were also recovered. Sabelo Munguni, a spokesman for the Mining Affected Communities United in Action, Makua, stated that a mobile phone sent to the surface with some rescued miners contained video showing numerous bodies wrapped in plastic underground. Munguni indicated that a minimum of 100 men had died in the mine, where police initiated an operation in November to evacuate illegal miners. He suggested that many may have perished from starvation or dehydration. During a community-led effort on Friday, 9 bodies were found and another 9 were recovered during an official rescue operation on Monday, which also saw 26 survivors brought to safety. South African Police Service spokesman Sabata Mokwangobone mentioned they are still verifying information regarding the number of bodies recovered and survivors rescued after launching a new rescue mission. Authorities aim to extract all remaining survivors from the mine, which has been the site of a standoff between police and miners since attempts to evacuate them began 2 months ago. Police reported that miners were reluctant to exit due to fears of arrest, while Munguni explained that they had become trapped after police removed props and pulleys they used for access. The shaft is 2 kilometers (1.2 miles) deep, making it impossible for anyone to climb out, said Makua's Magnificent Ndembele. According to South Africa's Sunday Times, the rescue company had created a specialized cage capable of descending up to 3 kilometers, that is 1.8 miles, into the mine shaft, with operations expected to last 16 days if all goes as planned. In December, Makua won a court ruling mandating police and local authorities to allow food, water, and medical supplies to be delivered to the miners. Illegal mining is prevalent in parts of gold-rich South Africa, where companies often close unprofitable mines, leaving informal miners to illegally search for leftover resources. Large groups of illegal miners frequently stay underground for extended periods, bringing food and equipment while relying on those above ground for additional supplies. Authorities have expressed uncertainty about how many illegal miners remain underground, but estimate it could be in the hundreds. South African officials have long sought to combat illegal mining gangs known as Zamazamas, meaning hustlers in Zulu, who are often associated with violence and criminal syndicates. Munguni emphasized that the trapped miners are not criminals but former workers who lost their jobs when mines closed and are now desperate due to poverty. And in other stories, Israel and Hamas on the brink of ceasefire deal, Biden says so.
On the war between Israel and Hamas, we're on the brink of a proposal that I laid out in detail months ago, finally coming to fruition. So I spoke to Prime Minister of Israel yesterday. I spoke to Emir Qatar today. I look forward to speaking with President Sisi soon. We're pressing hard to close this.
Elsewhere, Sierra Leone has declared a public health emergency following the confirmation of 2 cases of Mpox. The country's health minister made the announcement on Monday after the second case of this serious viral disease was verified. Health Minister Austin Demby informed reporters in Freetown that the confirmation of 2 cases of Mpox has necessitated immediate actions as required by the Public Health Act. He stated, and I quote, "On behalf of the government of Sierra Leone, I'm declaring a public health emergency." Last week marked first confirmed case of Mpox in Sierra Leone since the African Union's health authority declared a public health emergency due to the rising outbreak across the continent last year. The second case was identified after a 21-year-old man exhibited symptoms on January 6th, according to the National Public Health Agency. Neither patients had any known recent contacts with infected animals or other sick individuals, as reported by the Ministry of Health and Sanitation. The first case was linked to recent travels in Lungi, an airport town in Port Local district between December 26 and January 6th. Both individuals are currently receiving treatment at a hospital in Freetown. The declaration of a public health emergency allows for immediate mobilization of resources to control the disease, prevent its spread, and provide care for those affected, according to the minister. Ndembi also announced enhanced body surveillance and testing, along with a national awareness campaign. He reassured that Sierra Leone's healthcare system is prepared to handle such cases, drawing on experiences from previous Ebola and COVID-19 outbreaks. And I quote, "We urge all citizens to remain calm, stay informed, and report any suspected cases promptly to healthcare authorities," Ndembi emphasized. Mpox is caused by a virus related to smallpox and is characterized by high fever and skin lesions known as vesicles. Commonly referred to as monkeypox, it was first identified in 1958 during outbreaks in monkeys. Historically, human cases were mostly reported in Central and West Africa among individuals who had close contacts with infected animals. In 2022, it was confirmed that the virus could spread through sexual contact, leading to outbreaks in over 70 countries that had not previously reported mpox cases. The Democratic Republic of the Congo (DRC) has been significantly affected by this epidemic, accounting for most of the roughly 43,000 suspected cases. A decade ago, Sierra Leone was at the center of the Ebola outbreak that devastated West Africa, resulting in approximately 4,000 deaths, including nearly 7% of the country's healthcare workforce between 2014 and 2016. Kevin Juma, ETV Africa News, Sierra Leone.